Dr. Nandini Mundkar, MD, Director, Center for Child Development and Disability, Bangalore. Dr. Neelam Mohan is recently elected as a President, Indian Academy of Pediatrics, and very well known and experts are Dr. Arvind Garg Sahab. He is a senior child specialist, Apollo Hospitals, and Dr. Praveen Kumar, senior consultant, head division of Pediatric Neurology, Institute of Child Health, Sir Gangaram Hospital, New Delhi. Now I would like to hand over to Dr. A.K. Agarwal Sahab. He is our mentor and the chairman of our magazine's advisory committee and the professor of excellence, former dean by Maulana Azad Medical College, and presently he is the medical advisor, clinical and research, Apollo Group Hospital. Sir, over to Dr. Agarwal for today moderation.
Thank you. Thank you, Tiwari ji. Once again, a very good morning to all of you. We do hold this particular webinar mostly on Sunday morning. And this Sunday morning webinar is very important because here we are talking about pediatric age group, and that too in pediatric, the neurological segment, which in my opinion is very, very sentimental and emotional part for the family and part of the society also. What I understand that in due course of time, these conditions are perhaps on the increasing side. Why they are increasing, which are the conditions, how best possible we can look after them or prevent them. That will be our motive in next 1 hour. We have galaxy of panelists with us, all eminent in their own field. And I'd like to start with Dr. Arvind Kumar. Dr. Arvind is a leading pediatrician of North India based out of Noida. He is also senior consultant with Apollo Noida. Dr. Arvind, can you hear me?
Yes, I can hear you, sir.
Okay. So I would like to start with you. Can you tell me which are the common neurological conditions of pediatric age group? I would like you to tell us from neonatal to pediatric age group, and then whatever the upper limit of pediatrics, whether you take it 15 years, 16 years, or please let us know.
Thank you very much, sir, and thanks to Mr. Tiwari for inviting me in this esteemed webinar. As a pediatrician, as a pediatrician perspective who has been doing neonatology, seeing pediatric and seeing children up to 18 years to 21 years of age, my first take is the epilepsy is the commonest pediatric disorder in this age group, followed by, say, when the cerebral palsy, also the autism spectrum disorders, the certain neuro disorders there are many disorders like ADHD, and these are the common things which I would like to write. Specifically, epilepsy is really troublesome for the first-time parent. For them, the world has changed the moment the child was convulsing.
All right. So you mentioned few of the conditions which, according to your experience and as per literature, are one of the commonest conditions. And we'll take practically each and every condition separately. And to start with autism. So we have with us Dr. Nandini Mundkar from Bangalore. She is director of the Child Development and Disabilities Institute from Bangalore. Dr. Nandini, we have heard a lot about you. And of course, should I say that autism, which perhaps the numbers are increasing, and especially after COVID, it is felt that now the numbers are increasing more and more. So we'd like to give your expert opinion regarding the general feature of autism and what best possible can be done and why the numbers are increasing.
Thank you,
Nana.
Dr. Agarwal. It's such a pleasure to be having you with us and talking in this webinar. The childhood autism spectrum disorder, it's a spectrum. It's called autism spectrum disorder because the range varies from mild to severe, is perhaps like a silent epidemic all around the world. The US is reporting 1 in 57. We don't have a very good statistical survey from our country, but 1 in 100 is generally what people are saying.
Recently,
Now,
Times of India said 1 in 36 children.
1
yes,
in
sir.
36.
100. 1 in 100. sir.
36.
Yeah, this is
Yes,
what the
1 in
Times of India
36.
mentioned.
Actually, they are coming down and down. 1 in 36. You're right, Arvind. That now, what is the reason? Of course, is very debatable. They haven't got a very conclusive evidence for that in any domain, though they're looking into genetic factors and environmental factors. One of the, besides some genes and some segments have been identified, but they're not consistent in to call us that this is the gene which will be affected. But a lot is now going on two aspects. One is the maternal stress during pregnancy. That perhaps is being looked into in a very big way besides the other environmental factors. People are even implicating climate changes, the more and more exposure to the what should I say, the screen or the electronic media, mothers from during their pregnancy, whether that is going to affect is all debatable reasons. But whatever it is, that we are finding this number, and the whole problem of this is the best result of any intervention is when the child is diagnosed very early. Now, how early can the child be diagnosed? If very proper milestones are followed by the pediatricians and the general practitioners, which we should in the 4 domains of development, the social, communication, motor, and physical, especially the social communication is what is affected the most, and it is most difficult to comprehend this by the parent or maybe the general physician, because it has got very subtle signs. It's a hidden milestone. I mean, we don't bother if a child does not make eye contact. We don't bother if the child doesn't give a back and forth smile or has this going as early as 4 months. We don't really bother to say whether the child is showing a shared joy. Shared joy means by 6-9 months, child will get excited. Mama, see, they'll get excited when they want to share that joy with their parents. This child doesn't do, and we just don't worry about it. We don't, and another thing which is very, very important feature is what is called pointing. That is, a child points to things which it wants with his index finger like this. And by 1.5 years, we call something called the joint attention. Joint attention really means the child looks at the parent and looks at the things, points to things it wants, and looks back and says, that's what I'm interested, but he does not say it either. And these are very subtle signs of social skills which are not given importance, or cues which really makes a very good early diagnosis. Parents will come to you with delayed communication. Invariably, the referral age in our country is better now. It's around 2.5 to 3. They say the child is not speaking or not making eye contact and is not listening and prefers to be by himself or herself. I say himself because it's much more common in boys than girls. So this is the most common feature they will come with. Parents will not come with. Social skills are not there, but definitely will come with communication as a major problem for them, that the child is not talking or not interacting. And if they come at school age, they say the child likes to be by itself. It does not want to play. But join the other kids or doesn't call us when we call. That is the second. The third important features of this is what is called as the sensory deficit or restrictive behavior. These children like to do the same thing again and again. They may line up the toys, or they may take the same route. They will have they have difficulty in flapping hands. They like to see a spinning wheel. Some kind of repetitive actions and restrictive behavior. That is, they cannot do across the board. They'll be playing with the same toy, same way, so that these are the three main features, and they have sensory issues, which is the five senses. Either they'll be sensitive to noise or to touch. Maybe they say the child doesn't like a haircut. They will say that maybe it's cooker sound, they don't like it, or they will just say that he's running around vestibule affair, he doesn't sit in one place. So these are many of the sensitive sensory sound. So in sum, these are the main features of autism, and a very effective intervention program starting as early as we can, because as we are all aware, the brain, the neuroplasticity, the developmental neuroplasticity is very high below 2 years of age, almost 80% and 90% by 3 years. So we have a great opportunity to develop using the neuroplastic period to develop different skills in these children. The early intervention program should primarily focus on developing interaction with parents and developing social skills.
Dr.
If that
Nanni,
is-
Dr. Nanni, okay. We'll come back to you regarding
Yeah,
the solution. But as Dr. Arvind said, 36 out of 100, 51, even 100, that means we are ranging between 1% to 2% to 3%. Looking into the population of India, oh my God, what a number we are dealing with.
It's an explosion.
It is amazing. I am basically ENT surgeon. I look after congenital deafness, and we say that congenital deafness is approximately 1 to 2 per 1,000 live birth, right? But at the same time here, it is, I never knew that numbers are so big.
So that's why I called it the silent epidemic.
Silent epidemic, and which is likely to be increasing. Dr. Praveen.
That's it.
Praveen is our colleague, friend, neurologist of Gangaram Hospital.
Thanks.
I have very high appreciation for Gangaram Hospital all the time for everything. So Praveen, you being the head of the neurology unit of Gangaram, what had been your practical experience?
Sir, about autism.
Yes, let us, for 15 minutes, we'll concentrate on autism.
So definitely, sir, I echo the words as Dr. Nandini and Dr. Arvind also mentioned about the part that in past decade, we have definitely seen an upsurge of autism cases in our practice. I remember that when I was a postgraduate student, so we only used to read about autism in our Nelson textbook of pediatrics. We didn't have the cases of the part. Many times these cases were maybe misdiagnosed or not well diagnosed, or they were kept in a kind of like basket of global developmental delay or intellectual disability at that time on the part. But nevertheless, even if you look back and we look at our own clinical scenarios, the kind of signs and the symptoms autism children come, they were not there in those kids on the part. So it's not only about the not diagnosing them or misdiagnosing them earlier. It is definitely the autism prevalence and incidence has increased. And it has to be, definite because of the better diagnosis, definitely one thing, but because of the rising incidence also on the part, and which is always a matter of still a debate. I personally feel the rising cases of autism because they're coming from all sectors. Initially there was concern regarding people having old age. We see a lot of people with the first child in the 20s or the 30s, they're coming the children with the autism. People having other kind of like maternal factors, as Dr. Nandini also mentioned about the stress on the part. So what I find personally feel is there's a very heterogeneous group which is giving rise to this autism, and there's no particularly fixed part These parents are only coming with the children with the autism on the part in a way. That's one thing. My personal take is this is something like an epigenetics. So definitely genes are changing, and genes are changing with an influence over with the environmental factors also, which includes everything. Maybe you can say the stress, maybe you can say the pollution, maybe you can say when you are going to have your kids and all this part. But looks like because there was no one single factor being found out in most of these cases on the part, it has to be more of an kind of like environment and genetics playing into a role and giving rise to a much more higher incidence of autism cases in our day-to-day clinical practice on the part. That's the one thing. And second thing that I'll just add one thing, because the awareness is high. So we are also finding in last couple of years, like I think I will say in last 2 or 3 years, the children who are coming to us with the autism kind of like symptoms, they are coming quite early now. So I find I like parents coming to me even at around 2 years of the age that my child might be having autism on the part. That's a very good thing. So like I'm seeing this decline in the kind of like age group also, where children are being coming to us with a suspicion of autism.
Thank you. Thank you, Parveen. Dr. Arvind, sorry. You, in your practice as neonatologist, Dr. Nanni said that we must pick it up early as possible, right? And there are few indications even during the phase of infancy. Neonatology phase is very, very small, but in your phase of infancy, which you take up to 1 year, and later on, as what had been your experience in past few years versus last 20 years, or you have been practicing for a long time? What do you feel about the change of society?
My perception is same as Dr. Praveen and Dr. Nandini mentioned. Everybody has become more aware after COVID, and everybody is more well informed after COVID, and that is why we see very early. As Dr. Praveen said, we are seeing a lot of patients at very young age. As I mentioned, it's a really democratic illness. Nobody is paid, and cause is same in all. I have always been telling my parents, patient parents, that please keep talking to your child in correct diction with good eye contact. Although you may feel child is not listening, not responding, child is actually listening, responding. He knows what child mother is talking to the baby. As we know, the child is, as I mentioned, the deafness is could be one of the cause, but child can hear right from birth. After some time, will understand from the way the sound is coming. Then child will try to understand what is being told. Then gradually child understand what is the response. So this is a phase when the child has to respond. Most of the children respond vocally and few respond with sign language. That's where Dr. Nandi mentioned, if these things are okay, then the mother can be very reassured. But a lot of time, mother is actually very inquisitive. She's so much stressed. She comes for this only. But this is what I have been telling them. If your child you've been speaking correctly, you're giving enough time, your child is, in fact, in hospital, we are writing on discharge summary, no screen for next 2 years. This is what I have been writing to all the babies in my house.
That's very good, sir. That's very important.
Excellent.
Thank you, Arvind. I think I thought of discussing many more things, but it really shocked me when I came to know such a vast number in our country is talking. Dr. Nandi, back to you. So you said we would like to pick them early as possible, so that whatever early intervention you are planning should be most effective. Absolutely correct, right? Like for hearing loss, we would like to pick them up within few months. Even nowadays, we are doing neonatal screening program and try to rehabilitate them with some sort of hearing aid or cochlear implantation, even within 1 year of life or 6 months of life. So, according to your observation, in case, let us feel that the entire medical fraternity in relation to the child born, that includes the neonatologists, the pediatricians, and the family itself is very, very aware. How early as possible they can say, well, I suspect. Or there may be possibility, if they are so much aware, perhaps the child will not develop autism, because that means the entire efforts. What I could gather from all of you, it is the isolation of life. Isolated families, isolation, mother working, mother, father, and perhaps, as Praveen said, talk to child. ऐसे हमारे पुरानी फैमिलीज में तो यही था ना, जॉइंट फैमिली में जो भी बच्चा आया वो बच्चे को हिला के चला गया, कुछ बात करके चला गया है, तो वो चीज तो खत्म होती जा रही है.
हाँ sir, I mean
Please
very
proceed.
very important thing is, yes, more and more what's emerging in neuroscience of child development in very early years, which we are really missing out because the economic factors of parents going to work or shifting, and they don't live, the support from families, extended families, less and less. Like we have a lot of IT professionals in Bangalore from all over the country, and the post husband and wife, and both of them are working. So this child loses, what is emerging is importance of a single caregiver for bonding. It's called childhood bonding, which is very, very important for a child to have a stable emotional life as far as is concerned in any. So that is a crucial factor, which in a very, whether it is poor socioeconomic or a well-to-do, I mean, young developing youngsters, I call the generation G, Y, X, and they're all struggling with their own lives and too much into, they are into so much of social media, I mean, the screen, that they're not able to really give time to the child is one crucial factor where I think the whole world is campaigning against this now. And second thing I feel is a responsibility that we have to screen children with, following milestones. Very importantly, every pediatrician and every doctor, I mean, should take it up on a war footing if we want to diagnose, to look into the subtle signs I mentioned. And definitely recommended of the Indian Academy Pediatrics at least is by 18 months. We should do the screening by what is called the MChat. There's a screening tool for the autism. It's called the MChat, available in several Indian languages too. So at least by 18 months, if they really suspect with the failure, and that's only a screening, and then take evaluation for the diagnosis, if the child does happen to fail in the screening, would, I feel, be the most useful thing we can do. And counsel the families. I like Dr. Praveen, what he said is so true. We have to tell them the importance of interacting with the child, interacting socially, not glued. I had this wonderful mother. She was sitting in front of me. She was breastfeeding her baby, but she was on the mobile all the time. I don't even know whether she was concentrating on feeding on a baby. I told her, you have to bond with the baby. When the baby is feeding on your breast, you have to look at it, make some contact, talk to the child, not be on your mobile. So I think this is a worrying factor, which I think all of us have to address. Besides early intervention, the more and the best results, and if you look into the meta-analysis and review, is when the intervention is for parent-oriented or caregiver-oriented, and when they get involved in the intervention and interaction, then only the child gets a good result, and it can be very good at this age.
Thank you. I think.
Can I make a point, sir, here? Can I
Yes,
just add a
Praveen,
point?
please go ahead.
Sir, a small.
Yes,
Dr.
Tiwari
Neelam,
ji?
sir, Dr. Neelam has been
Yes,
joined.
I've seen Dr. Neelam. I'll go to Dr. Neelam as soon as I am finished with Praveen.
Yes.
Praveen, please go ahead.
I think, as Dr. Nandini also mentioned, that it becomes very difficult to identify them early, and which is the real challenge in picking up on the part. So there's two chunks. One is about the research work, where they are finding even in the antenatally when they're doing the ultrasonography of babies, and subsequently the fetal MRIs, they're finding certain differences in the babies of children who are later diagnosed to have with the autism, possibly because of the increased head circumference. Certain areas of the brain are slightly larger in the dimension on the part. So that's one aspect which is on the research. Maybe a couple of years down the line, we can pick them more early in the fetal life itself also on the part. Second, what I feel as a clinician that in the autism, the early signs are not the presence of certain abnormalities, like how we look at any other disease. So like typhoid, we look for the fever, high-rise fever, or we look for kind of like different kinds of symptoms in any disease process. In the autism, the most important signs are basically absence of normal development. So a child who is developing normally, if you're not finding the normal developmental process, absence of those normal features, they are basically suggestive more of a kind of like autism children in the part. So maybe even at around 8 months of the age, if you're really very, very, pointing towards the part, you'll find at around 8 months of the age, you can pick them up with the eye contact and the non-verbal communication kind of thing. And you can start looking for those further features on it.
Thank you. Parveen? Okay. So in between, we have been joined by our colleague, Dr. Neelam Mohan. Dr. Neelam, can you switch on your camera if comfortable? Dr. Neelam is recently taken over as president of IAP, and she is a very eminent pediatrician, especially in the field of gastroenterology. And we have been joined by our colleague from All India Institute of Medical Sciences.
Yeah.
Dr.
Sorry,
Hello,
Arun.
Neelam. No,
I was
perfectly
just
all right.
listening to them. I think let me
I'll come back to
listen
you,
and I'll
Neelam.
give
I'll
the
come back.
comments in the last.
No, don't worry. And we have been joined by Dr. Shefali Gulati, who is our colleague from All India Institute of Medical Sciences, New Delhi, and she is heading the Neurology Division of Department of Pediatrics in AIM, a very eminent neuropediatricians for the country. Shefali, can you hear us?
Yes,
Can
yes,
you
sir.
switch on the
Good morning.
camera?
Yeah,
if
good morning,
comfortable?
sir. Yeah. No, I can't. Actually, there was some medical emergency and I'm in an area where there's not very good connectivity. So I am not switching off the video, sir,
Okay.
because of that.
It's okay.
Connectivity is
But
very
are you
poor here.
comfortable in
There's a
being
medical
with?
emergency situation.
Okay. Are you
Yeah.
comfortable in
Yeah,
being
yeah.
with us?
Yeah.
And perhaps, in your absence, we have been discussing
Yes, sir.
about increasing number of autistic children and perhaps the predisposing factor, especially in isolated family, etc. Lack of communication with the children,
Mm.
and maybe epigenetics is changing, and that is only thing. There is one thing which Praveen did pick up. Futuristically, the numbers are increasing. We are worried. We are not worried only as medical
Yes, sir.
practitioners, but we are worried as part of the society. Will you allow so many autistic children to come up? This is not at all. We have to do something. So when I thought we have to do something, we have to screen. The fetal medicine is coming up in a big way, where the fetal ultrasound as well as now fetal MRI is coming up, which is perhaps picking up the neurological condition at a very, and the things have been validated by the science also. So what is your opinion about the futuristic research in the field of autistic children?
Yes, sir.
So that we are able to pick it
Yeah.
up
So,
even the child is born,
yeah.
even before.
So I understand. So this is actually a public health problem which has happened now with autism. And if you see our Indian numbers, the data which we have from India was the one which we had done in the INCLIN study and data collected in 2011, which was representative of our country, which showed
Shefali,
Her voice is lost.
Shefali, are you listening to us?
Connectivity has gone.
I think doesn't matter. She may join us back.
She joined.
Shefali?
I think the yes, sir, the connection,
Yes,
connection. I told you. So
we
that
lost you for a minute.
Yeah.
Please continue.
I'm saying that the autism, sir, prevalence is actually on the rise only because of increased awareness, and Indian data which we had is actually from the Inclin study from 2011. We collected the data, and that had shown 1 in 89. And the CDC Atlanta, USA figure of last year, which is there, was published in 23rd March 2024, but was actually 23 data was 1 in 36. WHO has that globally it is around 1 in 100, an estimate. So the numbers are on the rise, and they are much beyond because of increased awareness. And because, as you just pointed out, and although I missed the initial part, there are the causality is multifactorial, and many things we have been ignoring. Yes, you have some genetic predisposition, definitely, and they can be, you have a recurrence risk in families, which is there with the monozygotic and dizygotic twins, which the concordance has been seen, and in family and all they have seen that is there, and it is definitely heritability is there. It can be associated with certain conditions like Down syndrome and Down syndromes and tuberous sclerosis, neurofibromatosis, etc., to name a few, which are also genetic. But otherwise, we have many environmental factors which have to be looked into because of the exposure in the intrauterine life, the pregnant mother's exposure to air pollution, the exposure to pesticides. Most of our food and all is being contaminated by pesticides used rampantly. So that is something there. We are currently doing study both for air pollution as well as pesticide exposure for these children. Plus, there has been a lot of things on heavy metals. We've done 3 studies in the last 15 years on heavy metals, and we have now, the last study, we have also done the hair, nail, besides the blood and urine, because that will show the chronicity of exposure. And we have found many heavy metals associated more with autism versus non-autism. Plus, in the environmental factors also comes the father's advanced age and the stresses to the fathers. We've done a study in which we have done the father's sperm epigenome, and we have found methylation defects in the sperm epigenome of the fathers who have autistic children. And because then the father's advanced age, father's stress, father's lifestyle, all these are all modifiable things, so they will be there besides mother's age advance. And obviously mothers exposure to certain medications, yes, like SSRI inhibitors has been shown. Plus, besides this genetic predisposition, environmental factors, you do have the epigenetics, which, sir, you did mention. And I think the epigenetic factors in which your gene, because I am born with genes half from my mother and half from my dad, but the genetic expression is actually is modified by the environmental factors, and that may be the game changer and given therapeutic intervention targets. So the I think the epigenetic ones will come. So this, you can see that there are so many reasons, and one thing very clear: immunization has shown not to be associated. I'm the only Asian editor for the Autism Journal, and I wrote an editorial last month on autism and immunization, in which we did a meta-analysis and proved that we reiterated that there should be no fear for this thing. Vaccination, and because otherwise vaccine preventable diseases will be on the rise. Another thing is screen time. Screen time has been shown to be causing, it has been shown that screen time exposure high at 1 year of age has more chances of having autism by 3 years of age for boys, which was statistically significant, and had more autistic features in girls. So it is important to see how our society is changing and whether how we will be able to modify. But sir, even in the first year of life, you can actually suspect autism. We have at AIMS developed an AIMS infant screening tool for autism, in which we have studied beyond 1 month, from 1 month to 18 months. We have in 3 brackets questionnaire: 1 to 6 months, 6 to 12, 12 to 18 months, And we have validated that questionnaire, and we have found that at 12 months you can have a sensitivity of 90%, and 18 months 98% for picking up autism. And simple things like questions like a child whose vision and hearing is normal but is not responding to name by 6 months, so you can even pick them up early. And nowadays globally they're talking about like just trying to see with eye tracking and all. And lot of we have also developed in collaboration with many national and international organizations various eye tracking things. So they are also saying that if one child, because if you have a child with autism, we all know autism is 4.5 times commoner in boys than girls. So this was 4.5 times. Second, last year it has been shown that 4:1 hai, because that means the girls mein thoda zyada ho raha hai than earlier. And if your girl has autism in the family, the recurrence risk in the next pregnancy is 7%. If a boy has autism in the family, the recurrence risk in the next pregnancy is 4%. That means you need a more genetic load in a girl to have autism, so that the recurrence risk is higher. But if two children have autism in the family, the recurrence risk becomes 25 to 35%. Plus, also to complicate the matters, you may have 17.5% of families having history of some behavior or personality problems in the family, which may also complicate the matters. They won't have any DSM or ICD-11 diagnosis, but they may have some behavior issues. And we have also seen that there is one thing important also to be flagged is we have comorbidities which coexist. Why I'm saying is it's important for us to pick the child, and you can pick up even in the first year, as I mentioned to you. But as of now, there is no fetal marker by in the form of any ultrasounds or any movements which is there. Yes, placental studies are going on, in which you can do understand. But right now, right now nothing is there which will futuristically prevent. But ultimately, once you have a genetic thing and you're having family with autism and they are not very, yeah, then you will be future would be of pre-implantation genetic testing and genetic diagnosis, in which you already have a genetic cause in that, so they'll have to go through IVF to go ahead to do. But that becomes very important. And futuristically it is important to understand that you can pick up early. And that comorbidities I was telling you, comorbidities is that in clinical study we found that 12% of children in 2 to 9 years had neurodevelopmental disorders, and 20.8%, matlab 1/5, had comorbidities. That was overall for neurodevelopmental disorders, and 1 in 89, I told you, was the prevalence of autism. We recently analyzed data of 1,874 autism children in our clinic, and we found that 80% had comorbidities, which include things like ADHD, conduct disorders. You may have intellectual disability and all associated. This is important also to understand from causative point of view, sir, because they are and autism and epilepsy. Epilepsy also is seen commonly. So it is that many there are many of these conditions can be bidirectional, meaning you may have them coexisting, yes, but the same genetic thing may be causing autism and may be causing epilepsy. Same genetic thing in the brain would be causing intellectual impairment, I mean intellectual disability, along with autism. So it is important to understand, and it may be helpful to holistically see. But as of now, futuristically, we may like to do, but fetal thing will be coming later. Right now, people have been studying till the placental pathology, so we can't have an antenatal or prenatal diagnosis until unless you have a genetic defect identified and you test for that defect. But for autism, we don't have. And we have many genes have been identified. 700 to 800 genes have been identified with many copy number variations and many things. So abhi tak we don't have a panel ki, you do this panel, this genetic testing is done. Even last 7 years, we have also been studying all our patients and through IGIB to understand well. So wo bhi panel bhi banaye, so we it is pretty complex, but a lot of advances going on globally and in our country as well, sir.
So, Dr. Shefali, thanks for such a important information. I agree that autism, which is such a big in number, and perhaps we somehow In India, if the numbers are big, the suffering is also more because we are the most densely populated country of the entire globe. So perhaps with all the researches and whatever observations you did mention, we can take a lead in giving literature to the entire globe. And efforts are going on, as you mentioned. Dr. Neelam. Dr. Neelam, can you hear me? Dr. Neelam? Can you hear me? Dr. Neelam? Okay, I'll get back to Dr. Neelam now. Coming back to Dr. Nandini. Dr. Neelam is there. Dr. Neelam, we can't hear you. Tiwari ji?
Please unmute, ma'am. Hello.
नहीं सुन पा रहे हैं.
Okay, go on. Proceed on, sir. No issue. She will join
Okay.
later on.
Okay. Dr. Nandini,
Sir.
I would
Yes.
like to understand one thing more. Like
Yes.
we are, besides genetics, epigenetics, etc., the isolation part coming to be one of the very important factors. And had there been studies that joint family versus isolated family, overall prevalence of autism, the conventional big family, ground floor, first floor, second floor, living together versus isolated?
So, I mean, the most important thing we even discovered during the so-called pandemic was when parents were asked to spend time with the children, they really then realized so many things about their children that they didn't know. That that was an eye-opener for social interaction, understanding them, and then the exposure to, because they really, in my opinion, our parenting skills of interacting with children is quite not there in isolated families. In joint family, what was happening was the child did not have to necessarily just bond with the mother or the father. The single caregiver care, which is coming in a big way in early years, they had somebody, maybe the child was attached to an aunt, maybe it's the grandmother or somebody else. That part was so amazing in joint family, that which is so presently missing in the younger generation because of the work. They have to move out. They're no longer in their own places where they can have the privilege of having a joint family. To do this is certainly a very important factor in the management of these children, because more and more, if you look into the meta-analysis, they say the parent mediated program, a caregiver mediated program, or the NDBA model gives the best results in early intervention, which means we need to involve the family. So most of the time, we have to have a single caregiver to start with anybody. It can be, I'm not just saying necessarily it has to be the biological mother. Second problem with children with autism we find is they may learn a skill with one person, but they have problem in generalization. They may do many activity with their mother, but they not do it with their father. They may not do it with the teacher. They may not. So this generalization which has to happen really takes a very good form when we have support systems in the family. And third, I think more and more we are also realizing the maternal well-being. See, the maternal well-being to work with the child is very important. A mother who's stressed or having to do the job, come back, have a child with autism and tell her socially interact with that child, her cortisols are already so high with so much of work pressure high, the family dynamics matter a lot in managing these children, which I have seen over many years, and tremendous improvement occurs in children where there's a good family support and when there's no isolation. So undoubtedly, I feel if we have the privilege of having a good family and a good support family, it's going to be extremely helpful in the management of the children, because as I emphasized, it's the social skills we have to develop first. And interestingly, for this purpose only, we have just going to start a webinar on the power of play, which we are really aiming at, which we are going to, I can just send a brochure to put it into your double helix also. It's just that we found as we are growing up, our parents are losing that ability. And we have to socially interact with children, means we have to have a lot of skills of being a good, become a child ourselves. This is my take on this.
Dr. Neelam, are you there? Dr. Neelam?
Yes, sir. Can you hear me now?
Yes, I can. We can
Okay,
hear
because
you.
I could hear you that time. I don't know how I was not heard. So I went in,
But-
came back.
You know, the technology can go wrong anytime. And if it can go wrong,
Yeah, I am
Air
actually
India
apologetic
171,
that
then that
I
is
was landing and if the flight was delayed, but I can never say no to you because the amount of work you do and we all
thank you.
respect you tremendously. So
Thank you.
I thought it is
Dr.
my utmost,
Neelam.
and more than anything, for me, it was very useful listening to both Nandini and
But at the same time, Dr. Neelam, we would like to hear from you.
yeah, that's what I wanted to
If
say.
from
So role of
pediatric assessment point of view,
correct.
what is going
So
to be the
yeah,
mother
so
sensitization? Are there courses for mothers, family members? What
two
is
comments
in?
I will make, sir, here.
Yes,
First, I will make a comment as Dr. Neelamon, as a gastroenterologist and hepatologist. And from that point of view, I just want to say that when we talk about autism, there are huge amount of GI issues. In fact, in 70% of the patients, there are significant GI issues, and a lot of work is being done to understand the gut microbiome and whether these, because they're not able to communicate, what are the allergies you have. But if you look into the clinical presentation of autism, you'll be surprised that the most commonest disorder that they have in two-thirds of the patients are GI. It could be related to anything, right? As basic at, dyspepsia, allergies, discomfort, constipation, bloating, etc. So that was one point that I wanted to emphasize, and there's a lot of work and being done on that. But yes, I totally agree what Shefali was saying, that we now understand that the autism is different from the virtual autism that people get in India or globally because of excessive use of screen, and that is giving rise to a pseudo uh, autism, which they call as the virtual autism, because like Nandini was highlighting, right from breastfeeding a mom, she was hooked to a mobile while she was, and similarly the younger children less than 2-3 years before the brain plasticity is occurring. Because of that, there is the virtual autism. Having said that, Shefali also highlighted, which was very interesting, that even though there are facts that with increase in screen, there was a higher incidence, she said. That was news because yes, it increases, but it does give rise to virtual autism was there. What today, the second thing I wanted to speak was on the role of IAP as taking over as the president-elect of IAP. I think that there is a huge role of um, policies and NGO at our part. From my side, what I feel is it is not only the autism, the ADHD, the cerebral palsy, epilepsy, learning disabilities, these we would not talk about it so much, but the load that we are seeing now, they are no more rare disorders, but they are really underdiagnosed, underserved, and often misunderstood in our country. And the challenges that we face is delayed diagnosis, shortage of the trained developmental pediatricians, and the pediatric neurologists, child psychologists, all said and done, even in tier 1, they are not as much as you need. So you can imagine the burden that the tier 2 and the tier 3 are facing because of lack of such trained developmental pediatricians and specialists, and stigma of inclusion in the schools and society of this autistic kids and all needs to be addressed by societies like IAP and other societies, NGO. We need to come. So we realize that the multidisciplinary team intervention is very poor in the rural and tier 2 and 3. And IAP has done so far in developing the guidelines on autism, ADHD, developmental delay, screening. They're organizing a lot of conferences, which are mostly digital conferences, because you realize that pharma is not available because there's no definite medicines and that are there. So these do not get the light of the day in the form of a dedicated, CMEs and webinars which are pharma supported. So they are predominantly webinars which occur under there. And yet IAP has also been talking about the MChat and the INCLIN DDS, and ensuring that in all the CMEs there are such topics include, but we do not have still hand-on workshops that are available. So I think the way forward is a national screening program where we should make it mandatory for the developmental screen during the routine well child visit. While I was discussing yesterday with UNICEF, I was in Hyderabad and that's where I came in the flight back, is that it is the ASHA worker who visits. So we do not have still the chief medical officer who's visiting. So if we can have some way how this the government can advocate during the routine well child clinic when they come for the immunization and the growth at that time, they should look at the growth monitoring and identify the early signs which comes about the autism and that. And there is a need for capacity building, because we really need that the pediatrician should get into the basic skills of the screening. MChat should be, everybody should be knowing it, and that's how it should be. And so these are the two roles: capacity building, national programs, and maybe the government can facilitate some multidisciplinary hubs besides public awareness and advocacy, where societies like IAP can also work in the public awareness and advocacy and ensuring these are included in the educational policies and in the art. And it goes beyond doubt in what Shivali was highlighting about the research. We probably need a registry too. There is no registry also available in them. And what we can do to talk about insurance policies. These are so many things that I can think in a leadership role as I talk and not as a clinician. So to sum up my final note, I would say that yes, IAP, we have a moral and a professional responsibility to ensure that every child with a neurodevelopmental disorder, it gets the dignity of early diagnosis and the evidence-based interventions that are available, so that there's an opportunity for everybody to thrive. And with people like Nandini and Praveen and yourself and Shifali, there is a lot more for you all to do than it's being done. How you're going to train many TOTs and have many capacity building work that you need to do beyond your profession as as a clinician, you need to go beyond that. And India should get autism aware, but also autism accepting and inclusion driven. These are my comments. Thank you so much.
Thank you, Neelam. Wonderful comments, wonderful leadership on your part. And oral discussion in last 55 minutes, we realized we thought we'll be discussing other neurological condition also, but after starting dialogue of 1%, 2%, possibility 2.5% overall prevalence of autism in our country, I got so much carried away that we must do something for it. I think it is the responsibility of not only pediatricians, it is the responsibility of the entire medical profession, especially public health activities, which has to pitch in
So
now.
true. Arvindji,
Which
namaskar.
has
Sorry,
to.
I'm mistaking your name.
So I think with this, Tiwari-ji, perhaps you
yes.
have to divide this webinar into part 1, part 2, and which will be taking other neurological condition also. Yes.
Sir, एक चीज I wanted to add, which because I wanted, just
Yes,
one thing
sir.
which was missed, that something which is important is sir, gut-brain immune endocrine axis, something which is very important, and that like it has been we are seeing in our own children in the research that when you're eating the same food in the family, na, so your gut microbiome should be similar in the family, right? But our
Excellent.
autism children's gut microbiome was different than their non-affected SIBs. And then, we have done another gluten-free, casein-free diet trial, which has found up to be very positive, and another probiotics trial, which was not so positive. So a lot of research in that area also needs to be done. And one request is that, we have to empower the parents, which all of us are doing, all of us on the panel are doing. And, it is just important to understand that they should not be, because up to 86% of parents of autism use scam. So they hear from somewhere, they put something, they just keep trying hit and trial. So they should just help in research to help the researchers in India solve the problem and get like GFCSF diet. We have been able to answer the question, and we found that there is definite benefit. And I mean, because from International Society for Autism Research, which is US based, I've been the global senior leader for India, and this year on 1st May in Seattle, they had given fellowship for INSAR to me, which was important recognition for India on a autism platform for the research. So I think we should all collaborate and do a lot of research. Multi-centric research would be helpful, and join hands and empower the parents simultaneously and ask them not to just do a hit and try for something, because this is a chronic, lifelong situation which they have. And they have to understand the child will be autistic, although may go into remission. So we have to accept and we have to guide them in our counseling. Even as doctors, we'll have to do that, because we don't have separate counselors. So I think together we can do research and try to continue the research and
Yeah,
collaborate.
I would love, I'm glad you reiterated what I was talking about, my beginning statement as a gastroenterologist, that what I said about the gut microbiome. And I'm very happy, Shefali, that, thoughtful leaders could come on this forum and talk. And let's get down, connect to take this forward more, because there's a lot that needs to be done. That is being done in this field. I feel it's still huge amount of work that needs to be done in the field.
Yeah, can I
Thank you. Under your leadership,
Sure.
we will all be there. Yeah, Dr. Nandini, I'm just telling her that we are all there, and under your leadership, we'll be very happy to take it forward. Dr. Nandini, back to you.
Last one more thing, very, very problematic in our society, and I find is sleep. Sleep in our children is very bad. There are lots of sleep studies, and autism, particularly right from neonatal. One of the things parents will say is the irritability and the sleep problem the children have. As such, in our country, we look into it. We are not doing justice to sleep in our children. Watching mobile late, or the parents coming home, whatever. I mean, I've done a lot of interesting one small publication. I even do podcasts on these simple things on which health. But I think we somewhere along all of us have to understand the children's development during sleep. There's lots of research on how the brain needs rest and to learn. I think a very important point also to be added in that wonderful what Dr. Neelam and Shefali, you guys rock. You've done such a great job. You're all doing with research, and having the Neelam at helm, I think is going to be so helpful, And thank you so much. And
Ma'am, you touched my heart thing. We have done lot of studies on sleep and autism, and our study was published 15 years back, and we found that 77.5% of autism children had a
Hmm.
sleep problem on a questionnaire based. But then I did the polysomnography for all of them, which was a nightmare for me. To getting an autism child sleep in the lab was a nightmare. But we found that 100% had problems. So we have gone ahead and done more studies, and just now this month we have completed.
So in my practice, I could
Yes, Arvind?
as a pediatrician, I
Dr. Arvind, yes, sir, please.
Yes, yes, please proceed.
say that the diet and the gut dysbiosis is responsible not only for the autism is one of the factors. It is also one of the very, very important cause of allergic problem, which a pandemic is about to arrive. Similarly, the sleep has also been responsible for the adolescents who basically and it's a parent's lifestyle. So everything is, we just can't pinpoint one. Everything is interlinked. And right from, you see, we don't pick up at ADHD, for the ADHD now. So you've had an adult who's an ADHD and he's serving to society. So we have to cover everything in this. Everything is responsible. Not we
Absolutely, sir. Sir, actually, these are all across various neurodevelopment conditions, and we have to see the child and person holistically, manage holistically. So, and very rightly, sir, it is across many other conditions beyond autism. You're very, very right. Sir, I think 1 hour was very brief to discuss this
So,
complicated area, actually. Yeah.
Shefali, now I would like to give one comment from my side before I hand it over. तिवारी जी, मेरे कमेंट के बाद यदि कोई क्वेश्चन है तो क्विकली कवर कर लीजिएगा, अदरवाइज
We have question for
okay,
all
okay,
our.
just but today's question will remain confined to autism only.
Okay,
Right.
yes, sir. Yes.
So what I feel that it is a silent pandemic,
True.
which is perhaps as Parveen in the beginning said when he was a student, then it was perhaps somewhere in the chapter of Nelson. And Parveen, तो मुझसे नहीं पूछोगे जब हम स्टूडेंट तो क्या था? I did my graduation from KGMC Lucknow. The person like Dr. Bajpayee and all, the leading pediatrician of that time, were my teachers. And there were hardly a reference of autism.
तो पन्ने पलट देते थे हमेशा पढ़ते
Eh?
वो पेपर आते पन्ने पलट दिए आते थे कि बालों में कुछ समझ नहीं आता था
So now, with this increase of numbers, we have to really work on it. I think Dr. Neelam, as president
Yes, I'm thinking,
of
but I need a
IAP,
huge
you have to
Sena
take a
with me.
leadership. Your colleagues have
Who's
to
going to be the Sena? Nandini, and I'm working also for palliative care. There was a society who connected, and we planned an entire thing for the coming year. So I would urge Shefali to get in touch. Let's see what we can do. I've already communicated
Sure.
with some societies how to generate money. So how to spread this information. Let's talk it more. Maybe coming
Absolutely.
week, let's do a Zoom.
Sure.
Okay.
And
Sure.
Tiwari ji, I will request
yes.
you to come out with one dedicated your publication only for this condition, looking
Yeah,
after
that's a good idea.
all the
I
Right.
have
Taking
I have a
opinion.
single question for each of our panelists. One by
Okay.
one, I will read out.
Quick.
Now,
I've
first
already
question
given
is-
my opinion. Now
No,
I
no,
have
ma'am,
to.
ma'am, listen to me. This question, first of all, for you, as being a president of Indian Academy of
वही आंसर
Pediatrics,
दिया मैंने.
yeah,
Audio recording है.
I would like to know a question raised from the Ritika Sinha from Delhi. Could you tell us how do we ensure that children with neurological disorder don't face discrimination at school?
See, that's exactly when I said the
your voice is gone
awareness, but making a more inclusive environment. And that's what, and specifically, I said that autism accepting and inclusion driven. And I also said that it is time for us to understand and realize that these are some things which, as professionals, we can't, but together we can work towards this advocacy towards things. But it is the parents association who needs to come forward too, so that they are able to get their place streamlined. This is a very important issue which Madam Richika has raised, and I clearly mentioned this, that they are facing these issues, stigma and lack of inclusion in school and society. And this is an important point which I talked about. So there are a lot more brainstorming that needs to be done. How to do it's not only the professionals, it's the societies, which is not only the pediatric but the community at large, the parents. All of them need to come forward and streamline, brainstorm to how to take this forward.
Including public
you very
health
much.
experts. Including
very much.
public health experts.
Next question goes to Dr. Ravind Garg. This question raised by one of the viewer, Mr. Mohammad Arif from Calcutta. Sir, could you tell us what support system exists in India for low-income families dealing with such disorders, means child neurological disorders?
So I think I would say that this disease is democratic. It doesn't spare anyone. You come from low income, high income. The treatment is only one. You just keep talking properly, give time to the child. Just make sure, just remember, we have to go back to the days when we have everybody, like people are shifting from nuclear to joint family for this season. So that does need money. You just have to speak properly. And as I tell my all parents, you must speak in correct diction with good eye contact right from day one onward. Like Dr. Nandini was saying, breastfeeding, that is the most closest time that the mother has with her own child. The child enjoys for that moment. I would say that doesn't mean you have to be very rich for that.
Thank you very much. Next question goes to Dr. Nandini. As we know that you are doing a lot of activity for the autism, epilepsy, cerebral palsy. This question raised from the Kavita Nair from Kerala. Could you tell us how do you help a child with frequent outburst or emotional dysregulation linked to a neurological condition?
Well, it's a very difficult question to answer in one, but emotional outbursts. I want to, first of all, everybody here to understand every behavior a child has, temper, tantrums, whatever it is, has a reason. If you have to do what's called as a functional behavioral assessment, there is a reason for it. It's not that because the child's, we all know the prefrontal cortex, which really starts to develop around 3 till 24, doesn't know the reason. If you're talking about children young below 5 and all, there has to be something which is precipitating, and the child is not able to communicate either because of the language problem or are not understanding emotionally enough. So a good functional behavioral assessment, which really is very simple to understand, what happened 30 to 40 seconds before this behavior started, what precipitated this, and then the way to, I've done a huge 9 weeks course on behavioral management, which many of you have attended, and I wish I could put that back. What we talked about is, that's called what is called the antecedent for the behavior. The behavior, we all try to control the behavior, but that's not going to help. You have to really do the prevention, which is, or understand what was that 30, 40 seconds before the behavior happened, what happened, and try to modify that. Rarely, what are the consequences of this behavior, which we have to understand, but consequences are very rarely managed. Best is to do two things. One is the setting event and the antecedent. Setting event means a child who's not slept enough, or gastrointestinal problem, or child who's got a cold fever, not having had anything, will if you stress the child, it'll throw a behavior. Antecedent is what happens just about half a minute or so before the behavior. We have to understand and manage this. These two are the most important reason. Understanding a young child with emotional outbursts does not know what it's doing. It's really, we have to support it to understand and make it work. I can only say this in this short 1 minute.
Thank you very much. And next question about Dr. Shefali Gulati. Dr. Gulati, are you listening me? Are
Yes,
you available
yes,
on
Tiwari ji. Haan ji,
This
haan ji,
question-
बोलिए.
This question
Yes.
is from Anju Bansal from Madhya Pradesh. Ma'am,
Hi.
listen very carefully. She asking what are the risks of a misdiagnosis in childhood neurological disorders and how can they be minimized?
Okay, so basically important है कि if you're talking about neurodevelopmental and all issues, so anytime for the parents it's very important to understand कि if the milestones of the child are different from their peers, right? And if they are not attaining the milestones or if they are, sometimes like for autism, it is very important to understand when two things are there. Many times if they are in joint family, the grandparents will say the parents also started speaking late. So, if somebody has not started speaking, so it gets delayed. And the other thing is that they are not having social, social issues, social interaction, communication issues are there. You're not having eye contact. Then sometimes the grandparents say that, parents were तो स्कूल जाएगा तो अपने मिलेगा हाँ यहाँ तो जस्ट एक जजमेंट की न्यूक्लियर फैमिली है ज्यादा नहीं एक्सपोजर है सो whenever these issues are flagged you don't explain to them and not go and meet a professional and I think everybody has to meet a pediatrician or a developmental pediatrician if wherever possible or a pediatric neurologist wherever possible but at least a pediatrician to understand that everything is going on right because if you miss the initial part because initial first 2 years of life you have so much of neuronal circuitry being becoming in the brain so if you are not going to interact if you don't not going to intervene early so abnormal circuitry will be formed फिर उसका intervention में delay होगा and उस intervention में issues होगा so that is the importance of it and you see the child holistically and that is why I mentioned that 1/5 of these children with neurodevelopment disorders have comorbidities and very rightly as Dr. Nandini said was sleep has to be asked in all of them because those who have sleep problems at night their daytime
Thank you very much.
and obviously the quality of life of the child as well as parents and the siblings is taken for a hit sir and sir one more thing like what Nandini was mentioning about it. They're very, very important for the trigger to be seen. Otherwise, what happens? It goes from one doctor to the other. They add one medicine for behavior. They'll keep increasing that. But when the trigger is not being identified, so nothing will happen. And regarding the schooling thing, we are doing a study under the DST in various schools and colleges trying to understand the knowledge, attitude, practice of the students and teachers towards neurodevelopmental conditions and then doing a training and see how it improves. So that may help us also in improving and going in next steps that Dr. Neelam Mohan envisages.
Thank you very much, Dr. Parveen Singh. The question goes to Dr. Parveen. Dr. Parveen, could you tell me, can childhood epilepsy be completely cured with the right treatment or is it always lifelong?
That's very pertinent question. The first answer is this is not a lifelong disorder. Most of the patients or children with the childhood epilepsy, they come out of the epilepsy, almost around 70 to 80% of the childhood epilepsy, they come out of their epilepsy in next couple of years on the part. It's only a small number of patients with the epilepsy, they remain on anti-seizure medications for a long time on the part. So it's a good prognosis for more than 70-80% of children with the epilepsy. It's not lifelong.
Thank you very much. And the last question goes to, as usual, Dr. Arun Agarwal Saab. Sir, very simple question for you, as you very well aware. Sir, this question raised by the Anju Bansal from Jharkhand. Sir, could you tell me what the risks of misdiagnosis in childhood neurological next question. Fatima Rizvi. Sir, could you tell us, are there any non-medication therapies like music or sensory integration that show real promises?
Very important question. As one of our expert panelists did mention that we have to take this challenge in a holistic manner, right? So today we are talking about detecting the autism. We are trying to study the behavior, but ultimately, since the numbers are so big, we have to think the entire holistic approach for this. And whether it is music therapy, there are, believe me, from in India, just a minute, just a minute. Yes, sorry for the disturbance. So ultimately, Dr. Shefali, Dr. Nandini, we have to think in terms of totality. I'm sure there must be group working on it. We have to look into integrative care. We have to start thinking about integrative care, especially in case you are able to improve the microbiome status, if you improve the sleep cycles and all, what is going to be the quality of life? These are very important things, and perhaps we have to work more and more on this issue. Okay?
Yes. And I request you to kindly conclude the today webinar.
Yes, we had such a wonderful discussion, and we never knew that this is one problem which will perhaps not allow us to talk about other neurological condition. This is number one. And number two, please continue your webinar in part 2 regarding other neurological condition. Regarding autistic, please bring out one separate issue on this particular autism, and try to create, of course, the government is doing its own job by creating so many things, but double helical, it can also do something. So we can create a group, and that group can be connected with other groups all over India. Ultimately, it is not only the doctors, but ultimately it is each and every parent has to be involved into it. So that is my advice. I would like to thank all the panelists in front of me. Arvind, thank you very much. Dr. Nandini, Dr. Praveen, of course, Shefali. I know that you were somewhere else and you could join. And Dr. Neelam, thank you for joining, even you landed from somewhere. And to the entire team of Double Helical, special thanks to Tiwari ji.
Thank you, sir, very much. Thank you very much. Thank you, Bichan, very much, all of our panelists, eminent speakers. Thank you.